This is my setup at Gerard's dialysis unit. Nothing lacking that they do have in the regular dialysis center. Got my gloves, just got wipes because that's just me, extra hygienic, love that. Got my tape, got my mask and my swabs and my RPC chloramine testers for my water. Go up a little longer there, got my Clorox, gotta have that. Get that 110 and 100 ratio of water to bleach. Got my hand sanitizer, and I also got my own blood tube spinner. Yes, I draw my blood and I put in the tube and I package it up and send it off to the lab to get tested. So I'm a nurse. I just ain't certified. Oh boy. Oh, forgot. Gotta show you my PlayStation 5. That's entertainment. Most of the patients watch TV in the unit, but hey, I'm a gamer. Do not hate on me. I am a gamer, yes. 44 years old, I'm a gamer. That's my therapy. The wife loves it. Keeps me in the house. She ain't got about where I'm at. I'm always here playing my game and doing dialysis therapy. Got the 50-inch for the game. Go over a little bit there. Got the 50-inch for the TV. Yeah, this is my ultimate man cave. And this is my setup right here. Got all my supplies and medical things that I need for dialysis and the machine. Going on over here to the machine. I've already cranked it up, started it, already set it and set the lines, and there's my sodium chloride, or what you know as saline. And then we got our dialyzer. This makes everything happen. This allows us to basically get the toxins out of our body. The things that our kidneys should have done or would be doing if they were working, that's what that thing does. Those things there are the 1.5 solutions that we need. 1K for me is certain different calciums for everyone that needs it, according to the prescription that the doctor makes. But that's mine, and I got all of the bags hung up for a 3-hour treatment. That's the heater. Most dialysis patients, as we know, or those that don't know, they're anemic. And the nurses and the techs can understand. They want to say, hey, you know what, it's so hot here. Oh, it's so cold in here. It's so cold. The patients always saying how cold it is inside the clinic. That's because they're anemic people. The ones that don't understand why you guys are hot running around doing all that work in your gowns and in your in your mask and sweating to death. Well, we're cold. We're always cold. We're never going to change. It's never going to change. We're always going to be cold. If you don't like dialysis, get a new job, because that's what we are in there for. We're patients trying to get dialysis, but we're anemic, so we're most of the time always cold. Here we got my pad, got the 16 gauge needles. 16 gauge needles. These are about the size of a ballpoint pen ink cartridge. Yeah, it's pretty big. Now, I've been stuck with 15 gauge before when I was in center. Those are a lot bigger, but because of my prescriptions the doctor has me on, I'm going to do the 16. I've always been chosen to do the 16. This here is the heparin. This is to keep my blood from clotting. clotting inside the tubes. So I'm going to administer that. And there's the saline inside of the 10 cc syringes. There's my tape that I pulled, because I'm going to need tape to keep that stuff down on my arm. And I put that bag there because that's just my trash bag. Use my trash bag, okay? Great. Again, my setup. Oh, down there, the gray thing, that's the scale. That's my scale that I weigh on before I do this. So it's all maintained professionally in the right way. It's just not something, they sent me home to do because, hey, I said I knew what I was doing. I was trained as if I wasn't already the 20 years I had been in it. But they were just making sure everything was all right. I knew what I was doing, and hey, they let me loose, and I've been loose for more than almost a year now, doing my own dialysis, being my own nurse, because I am a nurse. I'm just not registered. All right now. Hey, I'm back, just like I said I would be. Today I'm going to go over cannulation and put myself on treatment, on dialysis treatment. Let me please tell you, dialysis has several different ways that can be done. A couple of them is hemodialysis, which I'm on. Hemodialysis, they do at the clinic also. You can do PD, which is peritoneal dialysis, where it's just like, a whole different situation. I don't even want to get into that because it has nothing to do with this. But I just want to, if you have any questions or any thoughts, desires, inquiries about other dialysis, go look them up. Because this is not the only dialysis that can be done. I want to make that very clear. Do what's best for you. Do what's best for you, and this is what's best for me. I don't particularly want to do any other ones. I've always done this since I was smaller, 15, so I've always, been accustomed to this. Again, I'm going to start here. I want to let you know, everybody that's out there, all your nurses and the techs that's watching me, all the medical staff and everybody, I don't have any gloves on. I have the hand washing that I use. I have the bleach and whatever other kind of sanitations there. I don't use gloves. I know they use it in the hospitals, they use it, but these are my germs. These aren't in a hospital or in a clinic where there's everybody else's germs. You're trying to stay, clean away from everybody. So I don't have to go to patient. I would have gloves on, but I don't have gloves on now. So don't get on the comments and tell me how, oh, you're not doing it right. You're not. This is how I do dialysis. This is how I was trained. So again, I have 20 plus years, which is probably more than whoever going to get on there and tell me what I'm not doing correctly, longer than them. So just kind of bear with me, please. No negativity. So hands are clean, sanitized. I'm going to start my process. This here is the heparin. Again, this heparin enables my blood not to clot. If it doesn't clot, that's great, because if it clots, then the machine shuts down. They have to restring it. It could be a lot of other difficulties, but this is what I go for and what I was taught to do. Again, don't have any gloves on because these are my germs and I'm good. I've been doing this for years, okay? How about this? Start with taking the bandage off from the last treatment. While I'm talking to you, I want to tell you about the setup that the company I'm going through. Don't want to do any name dropping because I don't know how that would hurt the YouTube. They may not appreciate it or not. I don't know. But don't want to name drop, but a company I'm going with that's allowing this, they indeed, gave me my lab spinner so I can spin my own labs and do everything else all by myself. I mean, it kind of sounds kind of messed up, don't it? They getting paid for what I do? Yeah, no. At any rate, but I'm happy because I can do it, and I've known very long how to, get this stuff going with no problems. So for those that don't feel comfortable, please let me tell you, don't be forced to do anything you don't want to do. But I'm just showing you how I do and what goes along with this, and it's not that simple. It's just not that simple, but it's not that hard. So don't, knock yourself as for what you think you can and can't do and whatnot. Hey, it's just not that hard. You can do it if you have it, put your mind to it. How about that? That better? Great. Well, take off the bandages. Gotta clean the area. I think in the clinic they said it's for 2 to 3 minutes, maybe longer. Um, but for me, again, this is how I do dialysis for myself. I've been doing it for a long time on myself, so I'm not putting anybody at risk, especially myself. But I do my cleaning as such. Some people use the alcohol swabs. I like these swabs. It's, I don't know, it's just something I like. Nothing different. Still alcohol based. Still does the same job. Sounds good to me. It works. Hey, if it's not broke, don't try to fix it. For those that are watching that chimed in with me, I appreciate you. Um, for those that chimed in to see if I was gonna cry when I stuck myself with these big needles, I appreciate you too. Um, but I again want to share and help. I want to make dialysis a known treatment, a known effective treatment, to which everyone can do this, not as down and as hard as it is. Now, don't get me wrong, please don't. It hurts, okay? Dialysis make you when you're cramping. It causes a lot of problems when you drink too much. You're over your dry weight. I mean, it really can be a situation that's kind of hard to handle. But if you have that discipline I spoke about earlier, then you'll get through it. And again, it does matter. Don't do things by yourself. Don't be in your little box and try to hold you. You be strong. I'm strong. I can take this. Because I was there. I used to do that. But a support system is a very, very, very good thing. Whether it's a friend, whether it's a mate, whether it's a family member. Hey, and I got both best worlds. My wife is wonderful with her, just putting aside her feelings about where I am in life right now and how she's going to support me. She supports me very well. Some people don't have that, and I understand that too. But it's good to reach out, and I will be glad to talk to anybody that wants to talk to me about what's next and where I'm at now in life. If I'm on dialysis, if I'm not, how about my mom, my auntie, my brother, my cousin, my uncle? Hey, they go through dialysis. Please share, 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 share. Subscribe, like, like, and share and subscribe again because I'm trying to get this through to everyone. And I just want to help. Just want to help those that don't know, that have a question, that don't have a good understanding. It has its flaws, it has its downside to being, kidney failure, but for the most part, you can get through it. We got breath in our lungs and we got a will to fight. You can get through it. All right? Let's get this thing going. All right? Clean my area. When we go in with the needle, that's called the arterial line, arterial stick. When you go in, that's the one right there. And venous, the venous line or the venous stick is the one at the top. Okay. Whether you have a graft or fistula is different because those two are two different access points, but still it's different. And we'll talk about fistulas and grafts and all that good stuff. If you have any questions, and we'll talk about those things. But right now, I'm here to tell you and show you how to cannulate yourself properly without gloves. Although it's my room, my germs. Can't let that go because I know someone's going to say something about that. But at any rate, this is the thing I was trying to do. I think I cut myself off. This is the thing that the company that provided me with the machine and whatnot. This is a tablet, but it actually, as you'll see after I get on, it takes all your parameters, all your numbers, all your venous pressures, all your arterial pressures, which I just got to talk about. Venous pressures meaning the arterial pressure of the bloodline and how it's rolling, if it's getting clotted up, if it's being clear, or if it's not going well. All this is being documented in this tablet, so it's very, very easy and very, very good. I can't speak negative of it all. I don't have one negative thing to say about it. Not only because it's saving my life, it's because, hey, it's a good deal, good piece of machinery. Okay. Um, Let it dry. They say in a clinic, I know you're not supposed to wave it or blow on it because you're putting extra germs on it. But hey, we're gonna go and do what they say. Even though this is Rod's dialysis unit, we're gonna do what I want to do. Okay. Get a needle out, and this is called the bevel. The bevel of the needle. I know you can't see it from there, but it's like a open on two ends, and you have to put it in there correctly. Place it down, close, so it's like so, and we're taking a 16 gauge needle. That needle is big, people. It's not a regular needle like you going to the doctor and take your blood. This is a big one. 15 gauge or bigger, but hey, I got the 16, and we going in. And the way you know you're going in correctly is by the thrill and the brute, if you will. And all that is a thrill, just like I said, a thrill. If you feel it, it'll be kind of gyrating, if you will. And you'll feel the blood, that's the blood going through. Going over the real good, okay? Gonna take that, go in there, and I'm in, people. I'm in. Another way you know you're in, real good, is when the blood flashes back. I don't know if you can see that from here, but the blood flashes back and forth, back and zoo, 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 zoo. And that's when you know you have a good stick. If it doesn't go back and forth like that, you did something wrong, or you didn't go into the right direction. And those are for the ones that may be helping you. Again, I said that having that support, you might not be able to stick yourself. You may have your cousin or aunt or husband or wife stick you. Well, I stick myself because I can only get mad at myself. If I don't get the right place, or if I hurt myself, I can smack myself. What you do that for? I can only hurt myself, and I don't want anybody to feel. I didn't want my wife to do it. I didn't want her to feel some type of way. I'm hurting my husband. This and whatnot, and I don't want that on her shoulders. So I'm gonna take care of this, knock this out, and let her be the wife. How about that? Okay. Got the flash still going. That's when you take this in and you slightly open it. You can see the blood running up. Slowly, 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 slowly. Stop it before it gets to the end. I'm gonna take this, which I should already had. I wasn't paying attention. Take this 10 cc syringe. Take the heparin that we spoke about earlier, and we're gonna take 2 milliliters out. And that is the doctor prescription. You probably shouldn't go over what the doctor prescribes because it'll hurt your body. They're doctors for a reason. Okay? I got 2 milliliters. That's my prescription and what my body needs. I'm going to take that and clamp that so the blood won't come out. Open it fully up. Stick it in there. And we're going to open again and open it up. Okay? We're opening it up. We're going to flash, push it back in, and the heparin is in there, remember? So I need to put the heparin in my body or in my blood so it can start doing its magic work and making the blood thinner, because that's what heparin does. It makes the blood thinner. It is a blood thinner. Duh. Okay. Go back and forth with that a couple times. clamp it. Time to go to the venous stick. Needle, cap off. Make sure you're going in right. And here we go. Make sure you feel the direction it's going in. You just don't want to go in willy-nilly. Just sticking everywhere, sticking everything. Make sure it's in the right direction. Make sure you feel the brute and the thrill. Either or, whatever you want to call it. And guess what? I'm going in. I felt it. And there we go. I don't know if you can see it, but there's the blood flashing back and forth. Right there. Woof, 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 woof. So you know I had a good stick. I stuck it correctly. Stuck it where it needed to be. I always want to put the tape on there to keep it down. This is not the best taping that I'm known for, but it is working for me. I do one tape. Some people in the clinic, when they tape so many times to keep your arm from moving and whatnot, and you know, you may be asleep, but you have some, well, I can't go to sleep. I have to stay up these 3 hours. So that's why I have my PlayStation 5. Who can't stay up and play video games for hours? I can. So that's what I do. And I got my TV right here. You may hear that in the background, which I'm sorry, I forgot to turn it down. I guess that was rude, huh? Well, I'm gonna turn it down. There we go. And that is the successful way of cannulation, or sticking myself. I'm gonna go back to the top of this one because it's the venous one. Open it up, see the blood going up slowly to the top, cut it off, then we're gonna clamp it. Clamp, open it up. This is a full 1cc, 10cc, I'm sorry, not 10cc syringe worth of saline. Why I'm going to do this, I'm doing this to make sure that the stick was good and I don't have any blockage, or I don't up against the wall of the, you know, of the vein and whatnot. So I'm going to open it up, see the blood fill up in there, so it's great. Going to go down, push it in. This is saline I'm pushing in my body. 1, 2, do it one more time, 3, and we're good. Okay. Well, I'm ready to go. Ready to put myself in dialysis. I'm gonna take this heparin and put it back here. Just to let you know, I can reach back here and get this. Here's my vinifer. This is my vinifer, or what you call iron. Again, dialysis patients need this because sometimes their hemoglobin isn't up to par, and the hemoglobin has to do with your blood count and whatnot, and you need to have it to get those red blood cells working. Red blood cells are very, very, very precious for dialysis patients because it takes, and don't quote me, it takes a long time for one, not all blood, one blood cell, one blood platelet, and you know what I'm talking about, blood platelet, to basically be made in the body, because that's what your kidneys do. Didn't know that, did you? We have a hormone in there that does indeed make kidneys help make blood. Everybody is so oblivious, and so was I. Don't get me wrong. Was oblivious to what, you know, was important in the body. Your brain is important. Your heart is important. The liver is important, but the kidney makes so much difference if you don't have its function. It knocks off your equilibrium, your balance. Wow. Did you know that if your kidneys have failed, and say you ate a French fry every day and your kidneys were failed, and you know you were already diagnosed as having kidney failure, you ate that French fry, just one French fry every day, sooner or later it'll make a difference, and it'll make you sick. It'll make you sick to the point that you'll die unless you get that kidney help or support or dialyzed or whatnot, because all foods, all foods have toxins in them. All, not just fast food, all foods, even a little grape in a grocery store that you might walk by and eat, you thief, steal. But you might walk by and, oh, this is a grape, pull a grape and eat it. That has toxins in it. And if your kidneys didn't work and were failed, you kept on eating that French fry or that grape, eventually you get sick. Sick to the point of dying if you didn't have proper kidney help or function. Because that's what kidneys do. Not only do they do the other things help you urinate and whatnot, you balance, it helps balance, but it also takes out all the toxins out of your blood. So kidneys are very important. Very important. That's why you see a lot of people that die from kidney failure and this and that and whatnot. I don't know the cases. I don't want to scare you because I'm not scared. I know what they're saying, but they're just saying, if you have a mind to want to help and live and fight and do, you can get through this. Dialysis is not a death sentence. It is not a death. It's not a death wish. It can be easily managed and taken care of properly. All right, got that done. Now we're gonna hook ourselves up, okay? Got the arterial line that goes to the machine, and we're gonna open it up and go to the same arterial line, which was red. It's always red, arterial line, always, even in the clinic, hemodialysis. In the clinic, the same thing. And this machine here, which I don't want to name drop yet, it does the same thing that the machine does. Actually, it does better if you ask me. But hey, tomato, hook up the red to the red, all color coded. You won't have no problem with it. And then we got the blue, which is the venous line. That's the one that's going in. The red takes the blood out the body, the arterial line. The venous line goes through the machine, comes back and pushes the clean blood. This takes the dirty blood out. This takes the clean blood, venous, and pushes it back in your body. And that's what dialysis is. Okay, you're going to take the blue, which is the venous. We're going to get this together. Kind of hard doing it myself, but I can get around it. Done it before, you still do it again. Here we go. It's connected. We want to unclamp 1, unclamp 2, unclamp 3, and then unclamp 4. Okay? Now this is what I do. Not everyone, but I do. Don't know. This is just what I do. Don't want to push or pressure anybody on the body. Just do what's best for you. How about that? I'll just leave it at that. Take my tape that I spoke of that I'm going to need. I'll put it on my wrist right there. That keeps it in line for me. Have everything on there. I'll pull this up just to have a little reach and freedom just in case I need to. And I'll take the tape and I'll put it on this line here to hold on to the dialysis chair, because this is a dialysis chair that the company did provide me, and I want to give nothing but credit to them because they didn't have to, but they did. Got everything situated here. Now we're gonna start a machine and set the parameters on here. Before I start, I appreciate you guys going through this with me. I do want to mention that this machine has 2 ways. I don't have to use these bags. These bags are a way to do in travel, or I can go vacationing and have these bags and take the machine. It's portable, put in the trunk, and it is very, very effective. But down here, and we'll go through this on another video. This down here is the pure flow. This is a concentrated bag down there, kind of like those bags, but just a different one big bag. And I hook it up, put it in there, and it lasts for about, I think, 3 treatments, opposed to me putting these up every treatment. So I don't have to put these up every treatment. I have something down there that I use sometimes where I can just leave that bag in there for about 2-3 days and have as many treatments as I want off of them. So there's different ways. It's not just a, one hitter quitter. It really matters, what better in your lifestyle, what matches your lifestyle or what you want to do, depending on, if you're a traveler, if you like going places all the time, it just matters. But with that being said, let's continue. We're gonna start it up. Again, the tablet lets me know that treatment started at 9:43 p.m. Yes, I'm a night owl. I like doing the late night. Actually, one of my nurses told me the other day, she was like, she was checking on me, make sure everything's all right on the phone. She's like, Rod, what are you up at 2 o'clock in the morning doing dialysis for? I said, because it's peaceful. It's peaceful. I love it. I'm up playing a video game, watching TV, watching my mystery, true crime movies, and playing my game, and hey, it works for me. And we're going. You see the blood going through the lines. Blood going through the dialyzer. It's turning red. It's at 250. The blood flow is now. I'm going to turn it up to my prescribed number, which is 350. It's at 350 now. Blood is all going through. I'm good. I'm not hurt. I'm not crying. I'm not sad. I'm not in any means any pain or detriment. So this works. This works real good. And again, this is just for encouragement. This is just for a will to know. This is not, oh, look at Rod. He can do it. He can do everything. No, because I wasn't there sometimes. It gets to a point where, hey, this is a little much. But I want to let you know, those that don't have that push or that power, that oomph in them, that oomph, you can do it. It's easy. It really is. No matter what we're going through, it's for a reason. It is. It is. And now we come over the hurdles and get through climbing the rough side of the mountain. It all works for the good. It does. Again, I want to thank you. Please do share. That's all I ask of you. Don't want your money, don't want your sympathy. I want you to share. Please subscribe. You don't have to pay anything to subscribe. Subscribe to me so you can get all my notifications of when I'm coming on next, what I'm talking about next, and I will get it done for you very, very, very soon, or as soon as you want me to. Looking at my numbers, this is the tablet that's taking all my correct. Let me show you here. All my correct parameters. It's Bluetooth, so nothing's connected. Works real well. Yep. I think they said I got about 3 hours on here. I'll be able to take myself off, but I'm not going to do that. I'm going to do that on my next video. Okay? My next video. I'll chime in and get around to about, when I've already completed about 2 hours, 2 hours and 30 minutes or something, and I'll be glad to pop in and show you how I disconnect myself. Nothing to it. Please again, share, share it to one, share it to all. Those not even going through dialysis. This is encouraging. I think it all, because God is good. God is good. No matter what we go through, God is good. And He's allowing me to do this and show this and be an encouragement to someone that may not be going through this, but be going through something, and say, hey, I got this going on and this going on, but I'm not dead. I'm not going through dialysis. I'm not doing this. I mean, there's a reason to be thankful. It is. And this is one. Again, subscribe, like, and share. Share the videos. Share the video to all. Again, I want to remind you, I do this, I guess maybe once a week. I think I'll try this maybe once a week. Different titles and subjects of what may or may not be wanting to see. If you have anything that you come up with, any suggestions, please let me know. I can do it. I'll do it for you. Be glad to. Just down on the comments below. Again, I do public speaking engagements to dialysis companies, to dialysis clinics, to encourage the ones. Let them know I had a kidney transplant, how to deal with a kidney transplant, how to take care of a kidney transplant. I've done it all. I've done it all with the grace of God. But I've done it all, and He's allowed me to do that, and I want to keep on doing whatever I can to help, because I was helped once. I didn't just wake up like this. I didn't wake up like this. I just woke up like this. No, I didn't wake up like this. I had help, had nurturing, and had patience. People that were patient with me, and that's what I want to do, and give back to what was given to me. Please indeed keep following me and keep sharing. Thank you.